Hi, I'm Dr. Felice Gersh, your integrative OBGYN physician. We're going to talk about something that has really been weighing on my mind. Maybe it's crossed your mind as well. It's the question of the role of progesterone in terms of weight gain or not. Does progesterone contribute to weight gain? This is a very important question because no one that I know wants to go through menopause and then just put on the fat pounds. Now, there are some people that are underweight, but they don't want to put on fat pounds no matter what. They want maybe muscle. We all want more muscle. So, every woman who has a uterus, and I say every woman, period, with or without a uterus, who takes hormone therapy after the onset of the menopausal transition is going to be taking progesterone. Hopefully, not a progestin. That is a sort of fake progesterone, a kind of a mimic. And we're not going to talk about progestins, those fake progesterones, because that's a whole different topic. And we definitely want to talk about that, but not today. So, what about bioidentical progesterone? When you combine it with estradiol, and some people are using it alone, which is inappropriate in my mind. Progesterone never just exists in isolation as a hormone without its buddy, estrogen. So we don't want to give progesterone alone, except in circumstances where you're trying to induce a bleed. Another story for another day. We're going to talk about hormone replacement therapy or menopausal hormone therapy, whichever words you prefer to use. Progesterone, as I've talked about before, and as a quick recap for any of you who are new to this concept, progesterone is typically given in combination with estradiol orally. Now, the estradiol is usually given transdermally as a patch, a gel, or a compounded cream. Occasionally, there are people using it orally. That is not, generally speaking, the recommended route of delivery. But progesterone is generally given, in fact, the vast majority of the time, is given as an oral pill, micronized progesterone. The micronization process allows it to get through the digestive tract without being turned into its amino acids just being digested. So it can actually potentially get into the body as progesterone. The problem is it goes what we call first pass to the liver. And in the liver, 80 up to closer to 90% of the progesterone is converted by the liver into metabolites, other stuff, like 30 different things. The dominant of this other stuff is a molecule which is not progesterone, but it comes from progesterone, which is called allopregnanolone. Now, allopregnanolone does always get made from progesterone, whether the progesterone is coming from an exogenous source from outside the body or from the ovaries, but not the way it's converted into allopregnanolone when you take oral progesterone. You get just little bits of allopregnanolone converted from progesterone, predominantly in the brain, although also in the liver, when you have progesterone get into the blood as progesterone. Well, what does this have to do with weight gain? A lot, okay? It turns out that allopregnanolone has been fairly well studied as a weight gain molecule. It creates what we call hyperphagia. It increases appetite and ingestion of food. It changes how animals and humans desire to eat. It makes you hungrier, and it makes you choose more high-fat, high-sugar foods. This has been shown in rodents, in rats. Now, there is data in humans as well, but there's a lot of data in rats, and there's a lot of overlap in how rats work and humans work. And the molecule is the same. Progesterone in rats also can be converted into allopregnanolone. But they've done studies where they've given rats allopregnanolone and they all gain weight. Those thin rats gain weight, what they call resistant to fat weight gain. Those rats gain a ton of fat when they're exposed to chronic elevated levels of allopregnanolone. So when you look at the conventional route of delivery of progesterone as an oral pill, typically 100 milligrams and sometimes 200 milligrams taken orally, you get a lot of allopregnanolone. With 100 milligrams, you get typically about 2.5 times the maximum amount any reproductive age woman would get, and about 5 times the amount any reproductive age woman would have with a dose of 200 milligrams. And there's actually, I went through and did the research. There's quite a few articles that talk about this effect and what does it do to? Well, allopregnanolone activates the GABA A receptor. GABA is a neurotransmitter that produces sedation, calmness. It has many benefits. We love all our neurotransmitters. It's always a question of too much of a good thing is a bad thing. So you get too much GABA activation. There's data that too much GABA activation increases appetite. Now, when is this important? Well, this is always a takeaway from when I talk. The prime directive of life is the creation of new life. Remember, I delivered thousands, well, in case you don't remember, I delivered thousands of babies during the 25 years in private practice that I was actively doing obstetrics. And it became obvious to me during those years that everything in the female body was evolved for optimal fertility, pregnancy, and then raising children. And to that end, you have to have a healthy body with all the organ systems working optimally. And you need to get through pregnancy. And remember, when humans evolved thousands of years ago, food was scarce. Starvation was the biggest threat to survival. So if you're pregnant, you need to grow that baby. And as a mom, you need to put on fat. You need to put on fat in case you don't get enough food. You have to have stored fat so that you can survive and be able to breastfeed your baby and get the food to the baby. So it turns out that we have data on weight gain and progesterone in pregnancy. And remember, the hormone is the same. With progesterone is progesterone, whether you're pregnant or not pregnant. And of course, you have other things that are in play, but still, the basic foundational things that progesterone does will happen at every stage in life, whether you're menopausal or you're young and you're pregnant. So let's look at the data on pregnancy and progesterone and weight gain. Well, in pregnancy, you have really, really high levels of progesterone, like 200 times higher than you'd ever have in a non-pregnant woman. We're never going to mimic pregnancy in a non-pregnant woman. Why would we want to? But they've done studies showing that women around 35 weeks, so they have 5 weeks left of pregnancy, progesterone levels are really, really high, and it can cause rapid weight gain. And that's really important because at the end, those last few weeks of pregnancy, women have to gain some weight because once they deliver the baby, they have to be able to focus on the care of the baby and breastfeed the baby. So it turns out that, of course, the same mechanisms are in play. In pregnancy, progesterone is converted by the liver and in the brain to allopregnanolone. Now, remember I said in a woman on oral progesterone, she gets several times higher levels of allopregnanolone than she would ever have naturally at any time other than pregnancy, okay, in a non-pregnant woman. Okay, in pregnancy, allopregnanolone is produced in high quantities from the circulating high amounts of progesterone, which correlates to rapid weight gain in pregnant women and increased intake of food and desire for food. Maybe other mechanisms are at play. I wish we had more and more studies, and hopefully there will be more. But there's published data showing that pregnancy, especially around 35 weeks when you have really high levels of progesterone, the allopregnanolone levels become really high. And this is really key for survival because you have to be able to gain weight for survival. And remember, back in the day, thousands of years ago, food was scarce. So you had to do everything to get women to eat, to gain weight, and to store it. And there's other mechanism at play in pregnancy to promote weight gain, which we can talk about another time. But progesterone is part of the action in terms of weight gain. What about in reproductive aged women who have normal cycles? What about progesterone in them? See, we can learn about what will happen in menopause when we give progesterone from what happens in other stages of the life of a woman. What about during the luteal phase, the second half of the menstrual cycle, a normal menstrual cycle in reproductive aged women? What happens with progesterone there? Well, in most women, not much happens in terms of weight gain, but a little bit. You may have some because of, the differences in the hormones, fluid retention, and so on. But in some women who have severe PMS, there may be something else at play. It's been noted that they may have what's called a paradoxical reaction to allopregnanolone. So remember, all progesterone has the potential to be converted into allopregnanolone in the liver, elsewhere, but mostly in the brain, and some of it will. That's what is supposed to happen. Well, it may be that women who have PMS, they either convert more into allopregnanolone during the luteal phase when they're making progesterone, or they're just more sensitive to it. Because there are women who are in the luteal phase, the second half of the menstrual cycle, and they suddenly get carb cravings. Have you ever heard about that? It's like, I just want to eat bread. I want to eat sugar foods. I want anything that's made out of flour, okay? They get carb cravings and glucose or sugar cravings as well. And that is this is what we think, from the high levels that the progesterone is creating in the brain of allopregnanolone, where some women, as I mentioned, either they make more in their brain, we don't know for sure, or maybe they're just more sensitive to it. And that's why they get these crazy carb cravings. So that's what is possible to some degree when you give women, let's get back to menopause, women in menopause, you give them oral progesterone, of which close to typically 90% is converted to other stuff, mainly allopregnanolone, and then they can get cravings, appetite dysregulation. Allopregnanolone is very key to having an impact on appetite and carb cravings. How is that? So just what we want as menopausal women, we want to take a hormone in such a way that it makes us have a higher appetite, uncontrolled appetite, and carb cravings. All the things that you need for survival during times when food is not readily available and a woman is getting close to delivery in pregnancy, and you just want her to go out and get food and consume it so that she will be able to support herself and her baby with the nutrients needed, the calories needed for survival. But this is not what we want as menopausal women. If you take progesterone orally every single night, you can count on an awful lot of it, probably close to 90%, being converted into predominantly allopregnanolone, which has been shown to change appetite, to dysregulate appetite, to make you more desirous of eating, like they said, hyperphagia, and eating carbs. So what do I recommend? Not that, okay? Yes, we always need more data. I'm always going to end everything with, of course we need more research. I'm desperate for more research, but I research everything and I go with what I got. Now, sometimes what I've got is a lot of data in rats. And I will always be honest about that. But we have human data too. We always have more rat data, but we have human data as well. There's article upon article showing the dysregulated appetite, or depending on how you think of it, it's dysregulated when you shouldn't be gaining weight, but when you should be gaining weight, like in pregnancy, then you could say it's properly readjusted for weight gain purposes. But we do not want that, okay? So what is it that I recommend? I recommend not taking the progesterone orally. Unfortunately, I'm hoping that we'll get a topical progesterone that is reliable, that is very consistent in its absorption capabilities, but that isn't quite yet. You can use progesterone as a topical cream, but you need to monitor very closely the uterus and try to see what levels are. It's not there unfortunately progesterone is not readily absorbed through the skin. Not that estrogen is either, but we have more ability to get estrogen consistently through the skin than progesterone, but it can be given that way as long as you realize that we don't have any proven data on safety and dosing, but it can be monitored. But now, what do I recommend? Vaginal. And there's a ton of data on vaginal progesterone. It's used all the time in infertility patients at fertility clinics. All the IVF patients, we have lots of data on it. It can also be used, and this sounds weird until you get over it, it can be placed in the rectum where it is extremely well absorbed. You just lube up the area really well. It can slip right in. You put it in before bed, and then it will absorb overnight, and you're done. So these are the best ways right now. Of course, I am really hoping we have easier ways than this, but this is what we've got. We have to face reality. We should not be taking progesterone orally. I went and I looked up all the data on weight gain from hormone therapy. They never have something just straight, like for in the OBGYN literature, just on progesterone. It's always as a combination. I have to go into more detail in looking for the research just on progesterone. And the data is sparse. I can tell you very sparse data. I found one study that showed, they said no statistical weight gain with a combination of oral estradiol and oral progesterone. Okay, that they used 100 milligrams of oral progesterone and of several different doses of oral estradiol. But what did they say made what they considered, clinically significant? In order to deviate from where they started, it was a very significant amount of weight gain, 15%. A woman had to gain at least 15% of her weight over the course of a year for them to say that it was clinically significant. I don't know about you, but if I gained 12% increased my weight by 12% over a year on hormones, I think that was pretty darn clinically significant. But this is what they do. They define what's clinically significant however they want. They say at least 15% weight gain. Wait a minute, that's absurd. Or close to 12 kilograms. Okay, that's a lot of weight. Oh my goodness. So that's what they used as a criteria. So then they said, well, there was no difference between those on the hormones and those who were placebo, that they didn't get any hormones. But the problem is what they considered clinically significant, no woman would think that that was what it was. They would say way below that was clinically significant. So, I think they kind of played the system so that their particular pharmaceutical, which they were, I think, trying to test, they wanted to show that, well, there was no clinically significant weight gain, but they defined clinically significant weight gain as huge. Okay, so anyway, this is the kind of stuff that's out there. We need better studies, but we have research, we have science, we have the data on women who are naturally having hormones, whether they're having cycles or whether they're pregnant, and we can learn a great deal. And then we have to make the best decisions based on the science, lacking enough clinical studies. But I don't know about you, but I have lots of patients who come to me on the regimens that are standard, a little bit of estrogen and oral progesterone every night, and they complain about weight gain. That shouldn't be. Of course, anybody can gain weight. Pregnancy will cause weight gain. Menopause without hormones will typically result in weight gain. But we know that human female hormones do not promote dysregulated metabolic states. And that's why I'm looking at different ways of giving hormones to better align with nature. For example, in the second half of the menstrual cycle, the luteal phase, when you have progesterone, the body will naturally make a little higher amount of estradiol. And maybe we should be looking at that as sort of a balancing mechanism. And if you think once again about the prime directive of life, and you think about the luteal phase when we have progesterone, in a healthy reproductive age woman, the luteal phase of the menstrual cycle is prepping for pregnancy. Remember, every menstrual cycle is for the purpose of creating a pregnancy. Only we as humans want to control our reproductive destiny, which over and over again I say, I'm not for unwanted, undesired, unplanned pregnancies. But understanding human physiology is essential to making good medical decisions. So if you think about it, since the second half of the menstrual cycle is prepping for pregnancy, if the egg became fertilized and implants, you want to have a successful pregnancy. And of course, the second half of the menstrual cycle is when you make progesterone. So it's not illogical to think that women would have an increased appetite, not to the degree that women with PMS have, but maybe a little bit, so that if they do become pregnant, they will have put on maybe a tiny bit of weight in preparation for getting through pregnancy. So we just need to be aware there may be, even under the best of circumstances, given the most physiologic levels of these hormones, a little bit of tendency to have an increased appetite during the time when you're on progesterone. And maybe having a little higher estradiol, which will help counter that because estradiol modulates appetite and controls it, will balance things better, especially if you notice in yourself that you tend to have a dysregulated appetite and you're always having a lot of carb cravings. So the bottom line is that progesterone is a good guy hormone. We love progesterone, but we need to understand what these hormones do and how they evolve to do what they do. And progesterone is critical for pregnancy, and it's critical for maintaining healthy bone and healthy brain and healthy skin and arteries. I mean, there are receptors all over. We're going to talk more about progesterone. But in terms of weight gain, maybe a little bit, it does promote some weight gain just naturally from its natural conversion to allopregnanolone, and maybe more so in women with PMS. And in pregnancy, through the roof potentially, especially later in pregnancy to help with producing more weight gain. But if you take progesterone orally, you'll have way more allopregnanolone than you would naturally have because of its heavy conversion in the liver to allopregnanolone from the progesterone. And that can dysregulate the appetite, create overeating and carb cravings, and none of us want that. We have tons of data in rats, and we have some reasonable data in humans as well. So I urge you to talk to your practitioner about maybe switching over to vaginal progesterone. You can use the same pill. It's actually designed for either placement and then using it cyclically. But we'll keep talking more about it. I'm trying to convince you based on the science. So progesterone may, especially when given orally, promote more appetite, higher degrees of intake of carbs, and maybe some weight gain, especially when taken orally.